I am so excited today to have the Vice President of Operations, somebody that has such a huge heart for helping people, and she's going to share with you some of the new exciting things happening with Impact and give you a little bit more of the history, the heart of this community that we're so passionate about. Eileen, thank you so much for being on today's call.
No, thank you for having me. Wow, Lauren and Jeff, every time I get on a call with you, I am just so impressed with how much you know about healthcare sharing and how willing you are to go out there and share that with others. But I want to also say cautionary to anybody who is new at referring Impact, you don't need to know everything about Impact. That's what we are here for. So I take a deep breath. You don't need to ever get up to the level of Jeff and Lauren. You've got them every Tuesday and you've got us. Well, thanks so much for having me. What I want to talk to you first is about how Impact got started. About 5 years ago, our president and CEO, Mr. Phil Chrysler, and his wife, Angela Chrysler, very philanthropic. They owned a savings company. And what they did was they did a little research on healthcare sharing, and they were going to offer healthcare sharing to members of their savings company. And as they dove into the systemic problem of the high cost of health insurance in America and the issue with people having medical debt due to having medical bills not paid for by, this is not uninsured people. These are people who had medical, had insurance, yet these bills were not paid for. So they saw this was a big problem, big need, and they started Impact. It is a mission for them. They are on a crusade to help people bring this to market and let people know that there is an option out there to give them affordable health care that's comprehensive. And I would argue better than a lot of the health insurance plans out there. And let me tell you why. Jeff, you said that some of the other healthcare sharing organizations are about to have price increases. Well, we all know that insurance has had price increases. In 5 years, Impact has not raised their prices. That's very important to Phil. We say to Phil, are you sure? Maybe you want to. No, how can he do that? We're a not-for-profit. He keeps looking for ways to give back to the sharing community. And that's the beauty of being a not-for-profit healthcare sharing. So I think what would be easiest for me to do is just to take Lauren's example of that couple that she met. And they are a family of 4, and she quoted them $605 for a $2,500 annual PRA. Well, look at this, guys. Here's what they're going to get. Everybody in that family is going to get a free annual wellness check with labs. They are going to get unlimited telehealth with MD Live doctors. They are going to get comprehensive health care. If somebody needs, they have mental health challenges, they need chiropractic, God forbid they need cancer treatment, broken bones, surgery, anything that they need that is a new diagnosis, new injury, new accident, new illness, they will be shared. Their medical bills will be shared by the sharing community. Now, Lauren, you pointed to the folks that have high blood pressure and high cholesterol. That's the 2 most common pre-X in the US today. Well, good news for those folks. If any one of these family of 4 in that position and they're taking their medication, they're seeing a doctor annually and they're taking their medication, God forbid they were to have a heart attack or a stroke, the sharing community would pay for those eligible bills less a 10% co-share. So it's very robust. I can go on and on about how many other things, maternity, babies, neonatal, they need neonatal treatment. God forbid somebody needs to be airlifted. All of that, it's right there in our guidelines. Transparency, we're not for profit. We're transparent about what is eligible to be shared and what is not eligible to be shared. So back to that family of 4. So they selected a $2,500 annual PRA. Well, part of being healthcare sharing community that's modern like Impact is we understand that there's a lot of people that want to be proactive about their health, which is why we have that annual wellness. They are into red light therapy, naturopathic, IV drip, vitamin therapy. They go to the gym. They want to have red light sauna treatments, cryotherapy. The list goes on and on. Anything that our members want to either take as a supplement or a treatment that they want to get that is for their health and wholeness, We're not judging it. They submit it. They get $100 a month credit to pay down that annual PRA. So you got a family of 4. If you just submit your supplements, your vitamins that you're taking, your gym membership, your massage, you submit that every month. Now that family of 4 only has an annual PRA of $1,300. We've helped them pay that down by helping them stay healthy. We also understand that families have dental and vision needs. So we are adding next week, the emails will go out to all our members to enroll in the dental and vision discount program, which is not costing our members a penny. We have added that to give that as a perk to our members. So how does that affect that family? Now you've got kids who need orthodontics. By the way, it's veneers. I had LASIK. It's a LASIK. You get 30 to 60% discount at no cost. Our members will get for that. So that family of 4, $605 a month, they are going to get comprehensive health care that runs the gamut from mental health to chiropractic to, surgical cancer treatments, everything that you can think of. It is a comprehensive healthcare option. It's modern. We have technology that matches, as you saw, Jeff and Melissa have recently helped several families pay their bills. What does that mean? These members had eligible medical bills, and while Jeff and Melissa were sleeping, a little bit of money was pulled from their account to pay those members eligible bills. But guess what? It wasn't done in secret. They log in and they can see how they're helping their sharing community. We're also modern, not only in technology, but in mindset. Most healthcare sharing are religious-based, and you must sign something that says that you believe in that faith. We're modern alternative in that way, in that although we're based on the Christian principle of love thy neighbor, we accept people from every religious backgrounds, and we have people who are Jewish, who are Hindu, who are Buddhist, who are Catholic, Christian, and we're very, very proud of that. Why? Because as these folks told you, they're on a crusade, and we're on a crusade too. We want to deliver to the community at large something, let them know that there's something out there that's mainstream for them, that's affordable for them, and that they don't have to go the high premium, high deductible. I don't know if you're going to tell me my anesthesiologist was out of network and I'm going to end up with this bill type of plan. It's also portable. You can go anywhere in the country. You want to go to the Mayo Clinic, MD Anderson. I live here in Florida. If I wanted to go to MD Anderson, nobody's going to tell me no, because I can go and be treated anywhere in the country. We also, to the providers who are on the call, you'll understand this, we do not practice what's called utilization. If your doctor says you need a back surgery, then you need a back surgery. If it's a new injury, new illness that causes that new diagnosis, the need for that back surgery, then you're getting that back surgery. We don't say, no, you know what, why don't you go for 3 months to physical therapy and then we'll take care of that. So you've got the medical freedom. You can choose any provider that you want to see. We help you pay down your PRA. We're not for profit, we're affordable. We help you pay down your PRA by staying healthy. We are completely comprehensive. It's portable. And to the doctors who are on this call, I would encourage you to become what's called a preferred provider, because you see those rates that they showed you, those outlandish rates, which don't even make me blink anymore when I see members' bills that are $200,000 that get repriced to $13,000. Those are hospitals that are doing that. That's not your provider in your community. The provider in the community is not charging $500, $2,000, 190% of Medicare. No. So we encourage you to submit the preferred provider form, and a member of our contracts team will reach out to you. They'll know what your codes are. They'll let you know what the rates are for your codes. And it's a very peaceful, positive experience, because we want to welcome providers to become preferred providers with impact. So that not only helps the members in our membership community know that they can, support the providers in their community, but it helps the providers to know that impact healthcare sharing is a good actor out there. Because as Jeff said earlier, sometimes, they don't know. A provider doesn't even know what healthcare sharing is. And you talked, Jeff, a little bit about pushback. I want to say that pushback, the majority of that pushback that you get will not come from, God forbid, you needed to go to the hospital. It's going to come from that small provider who doesn't, you go for your wellness check and they don't even know what impact is. So we have an answer for that. Coming next month, we are going to launch a concierge service. We're so excited about it. And this will be phase 1 of more concierge services to come. But phase 1 is our members need to go have a wellness visit, which is their physical and labs, which is 100% paid for by the sharing community. They'll just contact us. We'll have a prompt in our phone line where they let us know, this is the provider I want to see. This is when I want to go. We will contact that provider, book that appointment for them, and pay for that appointment in advance. So all our member has to do to stay healthy is to show up and have their annual wellness visit. Once we launch that, we're going to then move on to adding the concierge service for, surgeries that people have upcoming with their knee replacements, hip replacements, things of that nature. So we're super excited about that because you see, as a not-for-profit, we can continue to be adding things to the membership at no cost to our members to make it a better experience. And we're so excited to be able to do that. Next week, look for those emails that will come out for our existing members that will let you know, hey, complete this, and you can sign up your family for the dental and vision discount. And guys, there's no cost for it. It's not a sharing, it's a discount, but we've done business. I said that the founders of Impact used to own a savings company. We've done business with this company before. And when I tell you these are steep discounts on things like orthodontics and teeth whitening and braces and root canals and LASIK, it is something that you're going to go, wow. And it's seamless. You're going to log in, you're going to enter your zip code, and you're going to see all the providers in your area that are part of this dental and vision discount program. And if you have your favorite, eye doctor or dentist, and they're not a participant, there's a page there where they can be nominated to become a participant. Why would they want to do that? Because they get access to the tens of thousands of members who are part of this dental vision program. So we're so excited to bring all of this to you and to continue to add more and more to this membership without adding a price increase. All right, I know I haven't come up for air. I'm trying to be conscious of everyone's time, but I want to switch to the folks who are on the call, who are out there being the crusaders and talking to folks about Impact, letting them know there is this affordable, comprehensive option for them. Guys, we're going to be doing webinars for the next 4 months during open enrollment. Although here at Impact, we have open enrollment all year long. It's a great opportunity now between October 15th and January 15th to be having conversations with people because they will be going into the affordable care marketplace and shopping for insurance. And they're going to be paying astronomical amount of money with high deductibles, and they don't even know about this. So you want to have those conversations with them, and we're going to help you along with those conversations. We've got 4 upcoming webinars. They're going to be Monday nights at 8 p.m. The first one is October 21st. More information will be sent out about that. I also want to say, if there's anybody on the phone that on the call that has connections with hospitals where a contact person, we have a dedicated contracts person. Although we do not have a network, our members can go anywhere they want. If there's your favorite hospital in your community and you can get us the information of who we should contact, we have a contracts gal and she is tenacious and that's what she does all day long. And she'll contact them to help, get the ball rolling on getting contracts with them. So we've got a lot going on here at Impact. Open enrollment starts for the seniors October 15th. And if you've seen any of those commercials for seniors to get the Medicare Advantage, I was telling Jeff yesterday, I feel so badly for them because they think, oh my gosh, this is great, Medicare Advantage. No, what ends up happening with that is they're stuck. If they live here in Broward County, Florida, that's where they're staying. If they travel and go anywhere else and get sick or need to go to the hospital, that's going to be considered out of network and they're going to be stuck with those medical bills. So you want to have the conversation with anybody who has Medicare A and B and is 65, let them know how affordable Impact is, that it's portable, they can go anywhere, including out of the country, right? So if you're out of the country, and like I just went on a trip, I bought travel insurance for the trip itself. But a lot of people buy travel insurance, like medical insurance, for God forbid something happens to them while they're overseas. I didn't have to buy that because see, Impact, if you're out of the country and you have an emergency medical, you need emergency medical treatment, that is going to be eligible to be shared. So it's just phenomenal. How is it phenomenal? Because we're not for profit. Our only motivation is to help make this membership better and better for our members. And we're just excited to anybody on the call who's out there being a crusader to meet you in person. The whole Impact team will be there in Orlando at convention. And we're just committed to getting your questions answered. If you're not already registered, make sure you get registered for our training and come with your questions because we want to support you because you're out there being our brand advocates and it's just our privilege to do so. So get enrolled, signed up for that. Providers on the call, get signed up as a preferred provider. We would love to have you on board. And we are just thankful for the opportunity to be on this call today. At least I am. Thanks, Jeff.
Well, Eileen, I am so excited about everything that's happening right now. You mentioned the Concierge program. You said that's launching next month, meaning like October?
Yep.
So you guys are rolling out the dental and vision discount card and the Concierge?
Yep.
That is amazing. And I just want to make sure everybody heard what Eileen said. You contact Impact. They will call and make your appointment and they will prepay that appointment for you. Because remember, you get that annual wellness visit. And what I love about that is if the appointment is already paid for, there's zero possibility of you incurring that provider pushback that I talked about that sometimes happens. And some people say, how is this even possible that you guys are doing these things when everybody else is raising their rates? One thing I didn't mention before was that I know the goal of a good healthcare sharing company is to have 3 to 4 months of financial reserves. And if their reserves get less than that, they got to raise the rates. I know Impact is somewhere around 1 year of financial reserves, which is, I don't think ever happened before. And not only we're not raising rates, you guys are doing all these things as extra free member benefits for our members. I know there's a whole lot more planned for the future too. So we're so grateful for you being on here today, Eileen. And look, if we can bring Lauren back up on the screen here as well. And again, those of you that want to learn more about being a referral partner, about the business opportunity piece, make sure you get back to the person that invited you to the call and say, hey, look, I want to learn more about being a referral partner. For those of you that are like, hey, I really want to become an Impact member, remember, if you want your membership to begin on October 1st, you've got to complete that membership application. It only takes you about 15 minutes. There's no blood work required. There's no urine sample required. Nobody's going to come to your home. It's about a 15-minute process. You just have to complete it by 5:59 East Coast time on Monday, on the 30th, and then you'll be an Impact member as of October 1st. There's a $79 one-time application fee. You'll pay for that at the time of your of you signing up, and then you'll be a member with this Impact community October 1st. But Lauren, I know you and Melissa answered a bunch of questions in the chat. Was there any questions that you guys thought the whole community could benefit from that you want to either ask, that you want to ask Eileen or myself?
All I got was praise in my DM inbox here. Everyone was saying how great the call was. So I actually didn't get any questions, but Melissa, did you get any questions on your end?
Yes, a lot. But there's several that comes back to the same question, which is, what sets Impact Health Sharing apart from all the other health sharing organizations? Some people here have health sharing currently, but have worked with hospitals, or let's say the hospitals did not actually work with the patient and said that they do not accept health care sharing programs, what sets Impact apart?
Okay, so not only our modern, technology, but the fact that we are so member centric. It's, if you are going to a hospital and it's for something that's emergent, it's illegal for them not to. You can go there even if you have no insurance or healthcare sharing. So we don't see that kind of pushback at hospitals. But if we did and somebody was there and having an emergency situation, we'll help them. But you just really just don't see that when it comes to hospitals. What we see with the hospitals are those $200,000 bills for a $13,000 service. And by the way, guess what they say? Your husband's, the employee who got that $200,000 bill, we repriced it to $13,000. They had to pay their 10% co-share and their $5,000 PRA, and then the sharing community paid the rest. Guess what the hospital says to that $13,000? Okay, thanks. Why? Because they knew it wasn't a $200,000 service. That just is, it's mind-boggling to anyone who is new to understanding, just how broken the healthcare system is. But it's not to us because we see those bills every day.
One cool story, Eileen, is, the only time I've really ever had provider pushback myself, I went to the dermatologist. I needed to get a mole removed. And they were like, oh, we don't, bill healthcare sharing. Okay, great, no problem. Look, do this. If they just wouldn't do it, like, perfect. Look, let me pay as a cash pay discount. I did. When I went back for my follow-up appointment, I went to go check out. I was like, okay, like, I'm here to pay. They go, oh, no, we owe you $150. Like, what do you mean? Like, when we build that Impact Health Sharing company anyway, just to see what they did, we really liked what they did. They got back to us almost right away. So we owe you $150, and we will now work with any other Impact member moving forward. So just another, again, the reason they said that, they told me, is that another health sharing company took a long time to pay them in the past.
Yeah, they don't have the technology, and but there's a lot of good actors out there. But I'm glad you brought that story up, Jeff, because the concierge service is we're starting out with the wellness visits, right? We're gonna make that call for you, make that appointment, pay that provider, but it also gives us an opportunity to develop a relationship with that provider and tell them who Impact is and encourage them to become a preferred provider so they get advertised in the member portal and will, get more Impact members, get more, patients from the local community. And it just helps everybody, it helps our members, and it helps healthcare sharing in general. So we're so excited to be launching this, mostly for our members, to help you get those appointments, get those taken care of for you.
So excited about that. Melissa, what other questions?
All right, so let's go back to our seniors. 2 questions. Number 1, is dental and vision discount card going to be provided for them? And also, is the out of country emergency also available for our seniors?
So that's going to be, so everything about the senior program is predicated on what Medicare says yes to. So like somebody asked me about hyperbaric chambers, right? Well, Medicare, I looked on their website and they will pay for hyperbaric chambers for certain diagnosis. So if Medicare pays the 80, Impact will pay the 20. So that's going to depend on if Medicare will pay for any of those medical bills outside the country. I just don't know the answer to that. So the senior program works a little different than the regular program. Medicare drives the bus, and then we just, the sharing community pays the other 20% that they don't pay.
And just to make sure everybody heard Eileen's answer, the dental and vision program, yes, is also available for seniors. And to clarify, the $100 health and wholeness credit, that is just for members 65 years old and or under 65. The dental and vision is for everybody that's an Impact member. We're excited about that.
All right.
Also, I've got this question before, just over the phone and stuff, and people had asked if someone who's not an Impact member can take advantage of dental and vision, and the answer is no. You have to be an Impact member in order to receive that free dental and vision discount card.
Correct. That's a complimentary perk to our members. Hey guys, we got a question today because a lot of folks know people who live in Canada, and they asked if Canadian residents who live in Florida, half the year, if they're able to get impact, but they specifically asked about 65 and older. And so no, the answer to that for 65 and older would be no, because they have to have Medicare A and be 65 and older. But for anybody under 65, as long as they have a US bank account and a Canadian passport, they'll be fine. They can.
Awesome.
Right. So if a medical bill is repriced and the provider does not accept the reprice fee, is the member responsible for the balance over the repriced balance?
I love whoever asked that question. I love you. Great question. I told you that this is a mission for our president and CEO. Impact is a mission, and bringing affordable healthcare. He has a personal stance. He will not allow any of our members to get a judgment against them. We have a legal team. We monitor those. Less than 2% of the time, those large bills, we get pushback, and less than 2%. And in those cases, after round one with legal, you know, we might say, okay, we're going to give you 20,000, not 13. They'll say, okay. And in less than 0.5%, they have to push back again. Legal has to go round and round with them again, but be assured, members, we will continue to go round and round with them until it gets resolved to your satisfaction and our satisfaction. We will not allow you to get a judgment. So no, to answer your question, we won't need them to however they do their write-offs or whatever, that's on them. We don't really care. That's not a factor. What we care about is having our legal team negotiate on your behalf and say, listen, this is 5,000% of Medicare. You can't justify this, and we're not paying it. So let's take it down a notch. So we get very few of those, but what the important thing for you guys to know is Phil is committed. He's not letting anybody get a judgment. We'll keep up the fight and get it resolved for you.
I can speak on personal testimony of that really quick. One of my past ER visits, I received in the mail a summary of sharing from Impact saying, you know, this is what the bill was, it's a little over $4,000, and the negotiated price was $866. And the hospital didn't like that negotiated price, but I was told all I have to do is pay the hospital my $866, and Impact is going to dispute that on my behalf and, you know, take care of it. And so I'm happy. I got I'm all done, and I'm going to let Impact do what they do best. It was great.
Yep. We got a whole team for that. So I'm glad that worked out for you, Lauren. But yeah, we won't leave you hanging. That's important to Phil.
All right, so probably in the last 60 seconds, I've had 10 people message me. Where will they get information on the discount the discount card for dental and vision?
Yeah, great question. Right now, you might not have noticed it, but we put up a page last week called Perks. So when you go to impacthealthsharing.com, there's a little drop down there that is labs, prescriptions, perks, and it's got the health and wholeness credit page. That page for the dental vision will be live next week, but also every member is going to get an email and a link explaining to them what they have to do. They have to click on the link, and they have to enroll themselves and their family members so that they will get their discount. This way they'll be enrolled with that company, and they'll get their discount card in the mail so they can start, you know, going online and seeing what providers in their area are participating. So
one other question that I got, very excited to have everybody have access to that and to get those emails. And I've used the dental vision discount card for over a year now. Matter of fact, my dentist was the one that recommended to me. He was like, listen, like, you don't need to be paying what you're paying for dental and vision insurance. This will be better for you. I paid just under $300 a year to have that dental and vision discount card. It ran out this month. I did not renew it. And what Impact's offering actually is more than what I was paying $300 a year for. Impact's giving me so much more, and I'm paying nothing for it. So it's really awesome. But I already know the answer to this question, but somebody asked it in the chat, and I'd love to just have you take it. How does maternity work with Impact?
Yeah, great question. So Jeff, you had mentioned before about, hey, you enroll, you want to start October 1st, and that's it. You start right away. We'll start, you know, any eligible bills will be shared, right? It's not like with insurance. Sometimes you have to wait 90 days before anything is going to be eligible. So that's that. Now, give me your question again. Take that chat off. I started reading the chat. Give me your question again.
Okay, so here,
Jeff,
I got it for you. So the way that maternity works with Impact
Yeah, got
Everybody.
it. Okay, so maternity. So that's the only one where we do have a 3-month waiting. So as long as the estimated due date is within the first 12 months. So to make that easy for you, you start in January, right? The first 3 months, you can't get pregnant January, February, March. After that, you know, April, May, June, July is your estimated due date. As long as it's on the 12th month or beyond, then it's eligible to be shared. So basically it's a 3-month waiting period. Even if you go into premature labor, you have the baby 2 months early, that estimated due date said, you know, that it would have been on the 12th month or after, that's going to be eligible to be shared. So it's just a little 3-minute, and that's fair. You know, that's reasonable. By the way, the baby's bills are totally separate. And from the mom and the baby, you just have to sign that baby up within 30 days, get them added, and the baby's bills are eligible to be shared right out the gate.
Also, I'll add
Melissa
to
and I-
like licensed midwives and doulas as well, you know, that all subject to PRA, but is shareable as well.
Yeah, that's listed in the guidelines. We love our transparency. Just go to Impact. It's right there.
Yeah, Melissa and I have a friend that just 2 months ago gave birth, has been an Impact member now for well over a year, and went through the process with Impact. That she actually was on the share list of the month on the bottom left. I called her like, "Hey, this is you," when we shared in her medical bills, which is pretty awesome. So
I thought one of our consultants was on your list that you and Melissa recently shared into one of their bills. And don't panic, anybody, you don't have to put, mine says Ryan family, right? Yours will say Street family, but you can just be anonymous. But I love the part of seeing who you're sharing and helping out in the community. That's really, it's powerful.
I got a question from Jamie, and we kind of already discussed it, but Eileen, maybe in your own words, the question was, how does one know what providers accept Impact Health? Not sure if people's areas, you know, will accept it. So I don't know if we've talked about like the EDI, the payer ID number, and the provider support number, but if you want to touch on that.
Yeah, so what ends up happening is, like I said, you get that majority of pushback is with a small, like, okay, it happened to me, right? You got the girl at the front desk, I called to make my appointment, I've been going there 27 years, she looks in her little drop down, she doesn't see Impact, and she's like, oh, you're not in our network. You don't have a network, stop it. I know, I've been coming there 27 years. Here's what all you need to do is you need to enter our EDI payer ID number. So I had to like go through that little step to get that taken care of. Now that happened to be for my wellness visit, but we'll take care of that for you going forward with the concierge program. But Lauren, that is the other side of the coin to being able to go to any provider that you want. There's a lot of providers out there that Jeff's dermatologist, they don't know who Impact is. They've got their drop down loaded already with, you know, the top 10 insurance companies, and they don't have Impact listed. So that's going to take a conversation from the member to say, hey, listen, here's the EDI payer number. You just need to either enter this electronically or send it to the PO box, and the bill will be taken care of that way.
Awesome.
we
All right.
really appreciate your time today, Eileen. Can't wait to see you in Orlando. Again, for anybody that's going to be with us for the event next month, big convention next month that Impact will be at, that many of us will be a part of. Again, for those of you that are going to be there, make sure that if you want to be in that breakout room, it's going to be a town hall type discussion with Eileen and with Mr. Phil Chrysler. Make sure that you get that selected today because those spots will go quickly. So can't wait to see you in Orlando, and thank you so much for being on here on today's call. This call will be uploaded by tomorrow on the Facebook community for those of you that are part of the Facebook group. So you'll be able to go on there and watch the playback. You can tag other people on there so they can watch it as well. And we'll be back, myself, Lauren, Melissa, and the team next week to do another call similar to this next week, talking about and sharing the good news of Impact. So Eileen, thank you again so much. Lauren, do you want to just share that QR code one more time here for the Facebook group, and we'll wrap things up? I
just closed out of it, but if you guys type in Health Share Crusade Community, Health Share Crusade community. It will pop up, request to join, we'll accept you. And we'll post the recording by tomorrow. So thank you guys so much. Have a great rest of your day. God bless you guys. Thank you, Eileen.
God bless. Thank you. Bye.